The Guide to Septoplasty Surgery. If you have functional breathing problems with your nose and you'd also like to reduce or resize your nose cosmetically, a septoplasty combined with a rhinoplasty can help fix both problems at the same time. If this sounds like you, look for an expert in both cosmetic rhinoplasty and medically essential septoplasty. Because an expert can perform multiple procedures together in what's called a septorhinoplasty, here's a quick guide. What is septoplasty surgery? Septoplasty is a corrective surgery that straightens or repairs the septum. And the septum is the divider between the two sides of your nose. So it's cartilage and bone that it can be crooked, and what we do is straighten that up so you have more space on both sides to be able to get air through and to breathe. Many people have heard of a deviated septum, which is when the septum is crooked or slightly bent, causing breathing problems, nasal congestion, nosebleeds, headaches, or excessive snoring. And many functional nasal problems are made worse by enlarged turbinates, which are the structures inside the nose that heat and humidify the air. When I do a septoplasty on a patient, I usually perform a turbinate reduction at the same time to correct both issues that can be contributing to your trouble breathing. What is septorhinoplasty surgery? Septorhinoplasty is a surgery that combines a medically necessary septoplasty with a cosmetic rhinoplasty or a nose job for better looking, more functional nose. In a septorhinoplasty, your septum may be straightened or repaired to allow more air to flow on either side. At the same time, a rhinoplasty will be performed to modify your nasal bones, cartilage, and tissue to give you a more beautiful and aesthetically pleasing nose. A septorhinoplasty makes great sense for people who have functional nasal problems and also want to change the outside of their nose. Why go through two surgeries when you can do both with one? And from a surgeon's perspective, it's much easier to do them both at the same time because I use the cartilage from the septoplasty to make the nose look the way that I want it to look. And so it's much easier to do it at the same time than to have a septoplasty and come back and do a rhinoplasty and then you don't have that cartilage that's available to you. For patients with both septum problems and cosmetic concerns, I combine expert suturing skills and cutting-edge knowledge of the latest surgical techniques in order to give clients a nose that is superior in both form and function. Should I get a rhinoplasty at the same time as a septoplasty? Yes. If you have a medically documented septum problem requiring surgery and also want to change the look of your nose at the same time, a septorhinoplasty will accomplish both in one procedure. Note that if you have a septoplasty surgery alone to correct a medical issue, and it may in certain cases make a rhinoplasty more complicated later on because you don't have that cartilage available to make the nose look the way that you want it to look. So whenever possible, it is best to reshape the entire nose in a single septorhinoplasty. This will address obstructive or symptomatic septum issues while making the nose more aesthetically pleasing in the process. Does insurance cover septoplasty or septorhinoplasty? We get this question all the time, and it's a little confusing, but insurance will usually cover a septoplasty done for medically documented breathing or sinus problems, though copays and deductibles, of course, vary, and pre-authorization may be required. Insurance will not pay, however, for a cosmetic rhinoplasty or a nose job. Elective rhinoplasty is paid for by the patient out of pocket when a septoplasty and rhinoplasty are combined in one procedure. When they're done together, it gets a bit more complicated, and the insurance policies will cover the medically necessary part of the surgery, but not the cosmetic portion. And it really does depend on your insurance, how your surgeon bills, and the individual situation and needs. Many times, a patient can save themselves extra anesthesia and operating room fees by combining the septoplasty and the rhinoplasty into one septorhinoplasty surgery. Do I need a septoplasty doctor near me? If you're interested in septoplasty or septorhinoplasty, ensure that you have an expert facial plastic surgeon to perform your procedure. If you have questions, please reach out to me. We're happy to answer your questions. We are here for you. It's not uncommon for my patients to fly in from elsewhere to have me perform their septoplasty, rhinoplasty, or combination septorhinoplasty surgery. Have questions? I genuinely look forward to speaking with you. Email me anytime. Thanks for watching.